Welcome to Health Pulse, conversation with leaders shaping the future of healthcare. Hello, everybody. I'm Dhrupal Patel, and today I'm joined by Gavin Steketee, President at Direct Care.
Pleasure to
Let me
be
tell
here.
you something about Gavin. Gavin works at the intersection of employers and providers, helping drive transparency and cost reduction in a system that desperately needs both. So, Gavin, welcome. Great to have you here.
It's great to be here. Thank you very much for
Oh,
your time.
yes, absolutely. So, just a quick nod before we dive in. This is a very relaxed conversation. So, we'll go over your, professional journey here. Let me start with this. Was there a moment earlier in your career where something felt of like the system was not aligned with the patients or employers?
That's a great question. And well, there have been several examples. But well, first of all, I'm an architect by trade or education. So I get out of
Okay.
school, practice for a few years to satisfy my internship. But I've always been very entrepreneurial. I realized really early in, just interning in college and so forth that although I had a passion for architecture, it was really a passion for creating things, right? And being an entrepreneur. I was very entrepreneurial during college, always starting businesses and I mean, just enjoyed putting the deal together, so to speak. When I completed my education, I knew, being somebody that wanted to create, I knew that being an architect wasn't necessarily, although architects obviously create, but it's always creating what somebody else wants, right? I want to be the developer, the one that owns the land and buys the property and then, the one that ultimately is deciding what is built and decide, the ultimate decider on the design is not necessarily the architect. The architect is following, what the owner and developer want to do. So I knew that I needed to make some money. And so I wanted to get into sales. And then, I knew several people in the healthcare industry. And long story short, ended up at Aetna University, in Hartford, doing my underwriting training and, working for Aetna. And I honestly really, I like math, so I really
Okay.
liked and enjoyed the training. They do a top-notch job there. And back to your question of was there a point? It was soon after that training, and I went to take that training to the field, and I was constantly arguing with our underwriters saying this is not making sense here. So when I would look at the claims analysis and look at what they would draw up as a renewal or a proposed structure, it just wasn't jiving. The math wasn't adding up. So I knew something was off then, have continued to uncover multiple other, examples of that. I mean, I think we talked, when we last talked,
Right.
in that after my experience at Aetna, I then went to work for a PBM. At the time was Eckerd Drugstore's PBM arm, which was Eckerd Health Services. And I was fortunate to be leading a new region that was rather untapped. So they gave me a lot of liberty in or a lot of autonomy in what we were proposing. So what I did is I stripped everything out as far as all the PBM games.
Mhm.
And I just went full transparency. I was like, well, what do I have to lose? No one knew us in the Midwest region. I mean, Eckerd Health Services, they were like, who are you? And so
Right.
one was a good move because that was just what I believed in delivering. And Eckerd Health Services was this small PBM. But the next thing, it's been shortlisted on some of the big firms, Mercer, Aon,
Right.
and the reason being is wasn't the cool trend that it is today, where everybody is touting their transparency or
Right.
at least marketing, right, that they're
Right.
transparent. But back when I was working at Eckerd Health Services. A lot of, it was surprising to me, a lot of brokers and consultants and, of course, a lot of employers did not realize, the impact that rebates played. I mean, my first client, Children's Mercy here in Kansas
Mhm.
City, they did not know anything about rebates. They didn't realize that they existed. So we exposed that and then, won a big client really early on, and took that from one of the big PBMs. And then, then started to work with, it was Mercer pharmacists out, I think they were in Minneapolis, and, really got the attention of that team. And then, that turned into a lot of business, not just with them, but with, as I mentioned, some other consultants who were really looking for that, so the market,
Right.
at the time, I mean, it was like the wild, wild west. I think it still is in a lot of respects. I mean, I look at, what's going on in the PBM space today, and I'm
Right.
like, it's the same stuff. I mean,
I agree.
it's crazy.
Right, right. No, thank you so much for that. I mean, I appreciate how honestly you are framing that. So again, thank you. So, and the next question, like when you zoom out, what feels fundamentally different about healthcare today compared to even, say, 5 years ago?
One thing that's the same is change, right? It continues to change. But I think what I find as, I mean, as a problem that I think everybody's seeing and knows is
Right.
that the consumer is even more confused. And
That is true.
we're all, so to not we all, but the industry, the government is saying, hey, you're a consumer, you're a healthcare consumer, you could go shop, and there's been obviously a big shift to health, to consumerism, and that's great, except for it's very, very confusing, right?
Right.
So now we've effort to keep the premiums lower has really meant more cost shifting to the members or the consumers, and
Hmm.
expectation for them to know how to shop as a healthcare consumer. And it's confusing, it's difficult.
Right.
So that to me is an opportunity, one, to help the purchasers who are fiduciaries to their self-insured health plans, and help them help their health plan members be consumers. So, that meaning member engagement, nurse navigation, care navigation. That's something that I see is something that is critical for the consumer to have some guidance, have
Hmm.
tools, so that they are empowered. I mean, that's great that they have decisions and that they can shop, but if it's so confusing that, I mean, then I don't know that they're better off. So, I mean, I think the opportunity is to facilitate that, help
Right.
help people be consumers in healthcare. And that I see as being an opportunity for probably many years to come.
Right. No, thank you. That's really insightful. Means I think that's a great way to put it. And I know you work with employers, unions. What do employers and union expect now that they didn't expect before?
What do they expect now that they didn't expect before?
Do they see any change or the shift in this healthcare industry in terms of, what you are actually providing to them?
Yeah, what I would say is very encouraging is I've seen it at a lot of conferences where they get excited and talk a lot about doing things direct. I always like to say, to self-insured organizations, remind them that they are the fiduciary. Remind them of the conflicts that exist out there where, you know, Buca's being driven by Wall Street, insurance plans and PBMs not just commingling, but, under the same ownership, how that's a conflict, right? What I see as encouraging is more action from the self-insured, the purchasers, the fiduciaries, taking action to do the direct contracts. Whereas, 5 years ago, they talked about it, but
Okay.
it was very difficult. And, if you put yourself in their
Hmm.
shoes, it's great conceptually, right? It
Right.
sounds great to go to a conference, and they say, okay. But then when it comes down to it, then it gets really confusing, right? I mean, so
Right.
that's where we continue to find the market needs that specialist consultant, which is us. What we're providing is that roadmap as well as the tools and the partnership to do the direct contracts. So an employer doesn't have to, do a contract with, this provider and that provider. So we create that network for them because we're connecting with both sides. We've got the relationships with the providers.
Right.
We have the tools, the technology. So what we do on the provider side is we get them ready operationally. So one, we're developing a strategic plan for them that covers
Hmm.
everything from, getting ready to accept, you know, the technology and everything, getting them set up on that, talking with the different centers of excellence, partners that we have, Carum, Lantern, Transparent, see
Right.
if that's a fit for them or not. And then, developing a whole strategic plan for them as, individual organizations so that they, and obviously that's an active plan, and we then execute that. So then they're taking advantage of, all the opportunities for direct contracting, whether that be through one of our centers of excellence partnerships, the technology platforms, but then of course it's directly with an employer or union plan. I mean, you asked me earlier what was taking up my time this week. I mean, and that, which was very exciting, is back to another point was, what do you see differently? I mean, I'm seeing action. I'm seeing the self-insured organizations saying, okay, let's go, let's do this. I mean, so it's, as it was 5 years ago, they all talked about it. There's a lot more action taking place, and
Hmm.
there is huge opportunity out there. They don't have to turn everything upside down. I mean, we all talk about disruption, right? Well,
Right.
it's great, to an extent, but I think that's one of the things that employers are worn out of. Like you say the word disruption, and they're like, oh, geez, because,
Right. Exactly.
they could have gone through a few cycles of disruption, and the disruption was on them, or on their
Right.
members. We like to be careful with that word. I mean, so for the purchasers, one is we are going to simplify things for them,
Hmm.
and they can keep everything that they have in place. So if they want to carve out, great, they could carve out. But we like to give them a path if they choose to keep everything they have in place, but
I
take a
see.
take a step forward and at least have an offering, right? That is a direct offering, concierge level, and so that way, they don't have to force it on their membership, but it's an option. And
Right.
when they see the opportunity for savings and overall better value, when the purchasers see that, they're like that's when they're saying, okay, let's go. How do we do this? Let's get
Right.
that. But then, we put it in place where they then moving forward have several different levers that they could pull if and when, warranted.
I see. Okay. A good insightful. And I remember our earlier conversation where you said the hardest part, it's not the model, it's getting people to move. Where does that resistance usually show up first? The model that you build around your business, which is direct care, right? And you said that is not the hardest part. I think getting people to move, right? Like to adopt, to encourage, to take this advantage to opportunity.
Right.
So
Right.
where exactly that resistance, usually show up? Like, is it like when you introduce with them, that educate them, train them, kind of, on this kind of, or you provide the like a tailored path for them?
That's a great question, and I'm glad you clarified that.
So,
So, when I talked to you before about how we are looking for those that are already looking for us, right?
mhm,
So, if they're already leaning forward, meaning they've already got some kind of a direct relationship out there, or they want to do that. So, one of the spaces where we're getting a lot of this direct activity and the let's go attitude is those that are doing direct to primary already. So that's where, we're developing partnerships because, of course, we're focused on the specialty space. We're
mhm,
developing partnerships with these direct to primary organizations. And those purchasers that are partnered with the direct to primary organizations, they're already leaning forward. They've already committed to some type of direct contracting approach. So we just layer in there, it's the perfect next step.
right. And do you see any challenges to your overall, your business or achieving that goal? Like when you try to acquire more employer unions, is it like a adoption rate, it's low, or is there any challenges you see when you expand or scale your business?
Well, there's always challenges, right? So, bandwidth, where do we focus geographically? But, and we're asked that quite frequently. And the answer is we're going where we're pulled the most. So
Okay,
we're spending a lot of time in New York and Long Island area right now because I mean we've got these really strong provider relationships and the need there is so great because it's one of the most expensive parts of the country for healthcare. So and there's such a large population, right, of consumers.
right.
So, but then at the same time, we might have a relationship. I was just giving you the direct to primary example. Well, we were asked, hey, is is there any chance you could help us out in, California? And well, of course. I mean, we've got relationships nationwide. So then, next thing you know, we're talking to our providers out in south of San Francisco. And so now we're moving forward in that geography. So, the good thing is all the work we've done to build this foundation on the provider side is really
Okay,
paying off because we can, I mean, because that is always a struggle, is it's a chicken and the egg, right? Do you build the network and then take that to the purchasers, or do you go to the purchasers and say, hey, we're going to build you a network? I mean, because you have to do both, right? Well, we've spent the time to build those relationships where we could go to any geography and any specialty and we could set up a network to satisfy the needs for a purchaser,
right,
because even if you have a purchaser that is a union with a large concentration of their membership in a certain geography, they're always going to have people in other areas. So that I've seen to be a real struggle with startups where they're laser focused on a certain geography because of bandwidth. Although we have that, we also have that flexibility in the partnerships where we can go to any geography depending on need. So
Right.
we're just really focused on those that we are actively moving forward with and ensuring that we're providing the network needs to those purchasers, as needed.
Right.
We've got things set up where we can act really quickly with it could be something as, if there's a need for a knee replacement in a certain city, all of a sudden we can make it happen, negotiate a case rate, tap into our partnerships that we have nationwide, and we can make it happen.
Right. No, awesome. From the goal perspective, say example, you might have some goal or a milestone that you want to try to achieve this year. And say example, if we talk after a year and if really worked out, you said, hey, this is really working out, what would it be?
It comes down to solid references and case studies. Absolutely, 100%. I'm more focused on that than I am about, hey, we have X amount members. And yes, we want to grow, but we're the real deal. We want to grow with strong references and solid case studies. And we know that as long as we're focused on that and we're partnering with the right people, that is what we will see. And that is my number one focus.
Okay, awesome. And where can people learn more about direct care, or if someone wanted to connect with you, where people can connect?
So the best thing is either reach out to me via LinkedIn or my cell number, or you could go to our website, directcarenycnewyorkcity.com. A few other domains too, as obviously we're already, pulled outside of New York and in Long Island, but right now that is the website domain that we're using.
Awesome. Gavin, this was an incredible, I would say, thoughtful conversation. Means you're giving such a great insight, and I really like that openness, the sharing this insight to us, to our audience. And you're building something that challenges how healthcare has operated for decades and now doing it with integrity. So thanks for sharing your perspective with us, and I really enjoyed our conversation. So
Well,
thank you
yeah,
so much again.
I really appreciate it. It's been my pleasure to talk with you, and we're just really excited, and we've got a lot of independent physicians that are very excited, and we've got a lot of purchasers that are very excited about moving forward. So there's healthcare is always going to have its challenges, right?
Right.
But if we could take this active approach where purchasers, we're facilitating them being comfortable driving, being comfortable in the driver's seat, and then and make it better for their members, that's a lot to be excited about.
Awesome. Awesome. So again, really appreciate your time, and we are signing off now.
All right, thank you so much.